Well, what do we have here?
He burned his hand on a stove.
Did you warn him not to touch a hot stove?
Of course I did.
Well, I'm afraid we can't help him. Clearly he did this to himself.
That's absurd, isn't it? That a doctor would compromise care for a patient because he did it to himself. But unfortunately, overweight and obese people are the victims of this kind of irrational weight prejudice almost every day, whether it's in the form of negative attitudes, societal stigma, or unfair treatment. My name is Emmy, and as the first plus-size supermodel, trust me, I know what it's like to be judged based on my size. And that's why I'm here today, to raise your awareness of exactly what weight bias is, how it shows up in medical practices, and who its victims, sources, and consequences are. I'm hopeful that by the time that we come to the end of this brief journey, you'll be inspired to make subtle but critical changes in your own medical practice, and perhaps even adjust your own perceptions and treatment of your overweight and obese patients.
Weight stigma is bias and discrimination aimed at overweight people based on a series of social attitudes that people develop that can start very early in life that assume that there's something wrong with overweight people and that they should be punished for their condition.
Hi, could you help me?
Do you have an appointment?
Yes, I made it a year ago.
Name?
Cole.
Natasha?
Mm-hmm.
You can take a seat. Over a year ago, she must really hate coming to the doctor.
One important area where weight bias is expressed is in medical care. Overweight people are very often reluctant to go get medical care, preventive services in particular, because of biased attitudes they feel that they're going to encounter at the hands of healthcare professionals. There have been studies with physicians, with medical students, with nurses, with dietitians, with psychologists, and with other healthcare professionals showing quite negative attitudes and feelings that there's something wrong with the overweight person, that their weight condition is that their fault, and that because they haven't lost weight, there's something seriously lacking in their personality.
Ma, look, that lady's huge. Stop. Shh.
Weight bias can be as hurtful and difficult to counter as racial prejudice, and yet there's no anti-discrimination laws to protect people who are overweight. Weight bias is so prevalent in our society that most people don't even stop to question it. As a result, overweight individuals confront negative stereotypes and prejudice often on a daily basis.
It's important to recognize just how common this problem is in the United States. We recently examined a nationally representative sample of American adults and found that the prevalence of weight discrimination is comparable to racial discrimination and is in fact more common than racial discrimination among women. We also found that the prevalence of weight discrimination is more common than discrimination due to ethnicity, religion, sexual orientation, or physical disability.
It's important to consider that statistically, 6 out of 10 patients in your waiting room are already overweight or obese. And that number is rapidly on the rise. And most of you know that obesity has doubled in the past 20 years in both children and adults. And frighteningly, it's tripled in teens. 1 in 5 children is overweight. And overweight children tend to become overweight adults. 30% of adults are obese. And we're right on track for this trend to continue. Whether or not you want to deal with this, the obesity epidemic is increasingly going to impact your practice. And as these numbers continue to grow, anything you can do to make your overweight and obese patients feel more comfortable and accepted will translate into an improved work environment and a more successful practice, and most importantly, better health outcomes for your patients.
Ms. Cole, the nurse will take you in.
The stigma of obesity is so strong that even healthcare professionals specializing in the treatment of obesity hold negative attitudes towards the obese and infer that these people have blameworthy behavior.
Step on the scale, please.
I'd rather not.
We have to weigh you.
It's the same as last time.
We need it for our medical records. $260 pounds. What are you, 5'4"? You've gained weight since last year. It looks like your diet isn't working. Please move into the examination room. The doctor will be right with you. How hard is it to push yourself away from the table?
I know, and get off the couch. Nothing to it but to do it.
You gotta work hard to get that overweight.
Physicians limit their interactions with obese patients, are ambivalent about treatment roles, and are reluctant to perform certain screenings. Studies have revealed that nurses too view obese patients as lazy, overindulgent, non-compliant, and less successful than their average weight counterparts. Nurses self-reported alarming statistics. One study found that a third to half of the nurses surveyed admitted feeling uncomfortable caring for obese patients. Many would prefer not to touch obese patients. A quarter of them agree that obese patients repulsed them. And fully a third would prefer not to care for obese patients at all. And these are their caregivers.
This thing isn't big enough for you. Here, change into this. Does anyone know where the extra large blood pressure cuff is?
So weight bias could affect an individual's health in many ways. Just being the victim of discrimination could affect your health. But then you add to that the fact that people don't get care as they should because of the biased attitudes they expect to encounter, creates a real problem.
Healthcare providers are not immune to weight bias, and unfortunately, many overweight and obese patients report negative experiences from multiple groups of providers. As an example, we surveyed over 2,400 overweight and obese adults, and we asked them to tell us about the different sources of weight bias in their lives. What we found is that physicians were the second most common source of weight bias reported. Fully 69% of people reported weight bias from physicians, 46% from nurses, 37% from dietitians, and 21% from mental health professionals. So this really is a common experience for many individuals in the healthcare environment.
Let's take a look at the impact of all of this to see why this is such a critical and urgent issue.
Well, there are a range of negative consequences of weight bias for both emotional and physical health. For example, we know that individuals who experience weight bias are more vulnerable to depression, low self-esteem, poor body image, and even suicidal behaviors. We also know that individuals who experience weight bias are more likely to engage in unhealthy eating behaviors like binge eating and avoiding physical activity, both of which may ultimately only reinforce weight gain and additional obesity.
It's not a leap to conclude that when patients experience bias, their preventative care is compromised. So what's the solution? What can you do? The solutions are so simple. Treat your overweight and obese patients with the same courtesy you treat all of your other patients.
Mrs. Cole, how are you today?
Great, thank you.
Good. You here for your 10:30 appointment?
I sure am.
Great. Just take a seat. The doctor will see you shortly.
Thank you.
There are a number of things that health professionals and medical offices can do to combat weight bias. The first is just to take a look at the physical environment of the office. So, for example, making sure that in the waiting room there's room for people to move around, that there are chairs that are large enough to accommodate all patients. And it's important to even look at the reading material in the office, because things like, fashion magazines that have a lot of very stereotypical images of women and exaggerated images of, female beauty can sometimes be disturbing to patients, feeling like they're, constantly surrounded by those images. Another thing that medical professionals can do is make sure that the place where they weigh patients is private. So we recommend that the scale is off in a separate section of the office. It's not visible to other people. And another thing that helps a lot is to actually ask the patient if they would like to be weighed. It's a way of showing respect for the patient's decision whether or not they feel that that's important for them to do during that visit.
Hello. Would you like to be weighed today?
No, there haven't been any significant changes.
Fair enough. There's a gown right there, and I'll be right back to take your blood pressure.
Great.
Provide larger sized gowns, larger, sturdier examination tables. Provide larger blood pressure cuffs to your patients who require a larger size.
It's very important for healthcare providers to increase awareness about their own attitudes and assumptions based on weight. And providers can ask themselves questions like, do I make assumptions based on weight regarding a person's character or intelligence or success or lifestyle? Am I comfortable working with patients of all sizes? Do I give appropriate feedback to encourage healthful behavior change? Am I sensitive to the needs and concerns of obese individuals? Do I treat the individual or only the condition?
Another important aspect of reducing weight bias is to really understand the complexity of obesity. People think that for someone who's overweight, all they need to lose weight is some self-control and trying harder to eat less and exercise more. If that only worked, we wouldn't have the problem that we have today. The causes of obesity are very complex. It is a combination of genetic factors, environmental factors, psychological factors, and it's important to recognize that so that when we look at someone and we see whatever their body weight is, we don't make assumptions about their behaviors based on that information.
It's important for providers to recognize that patients may have had negative experiences with weight bias from previous providers, and so when they come into the office for the first time, providers need to be aware of these issues. We often hear from patients that when they go into the doctor for a problem, such as an earache, that the doctor frequently will blame the issue on their body weight, even though it has nothing to do with the presenting problem. Many patients have tried to lose weight repeatedly in the past, but have been unsuccessful. And so when a patient comes into the office for the first time, telling a patient that they need to lose weight is something that the patient has probably heard many times before and is not necessarily the most helpful advice to give. One thing that providers can do is to really emphasize behavior changes rather than just the number on the scale. We want to be setting goals for patients that are realistic and achievable. So things like, can they increase their consumption of fruits and vegetables, reduce intake of soda, walk more frequently during the day? Very tangible strategies and goals that patients can work on to improve their health. It's also important for providers to recognize that relatively small weight losses can have important improvements for overall health. And so even if an individual is able to lose 5 or 10% of their body weight, that can have very important implications for their overall health. They may be able to get off certain medications or to lower their blood pressure, and communicating this to patients can be very empowering as they try to make behavior changes. If weight loss was easy, we would not have the current obesity epidemic that we have. And so it's very important for providers to acknowledge how difficult this is and to provide support.
Patients are 3 times more likely to address diet and lifestyle changes if their doctor constructively and sensitively calls their weight to their attention. Yet less than half of physicians actually do.
Well, Mrs. Cole, all your vitals look great. It sounds like you're doing great. Would you mind if we talked about your weight?
Sure. I know I could eat better, get more exercise.
I'm glad to hear you're thinking about ways to improve your health. But it's important to remember that body weight is only partly determined by diet and exercise. Still, we can all stand to make lifestyle improvements. Let's talk about what you're doing now and how effective that is.
Okay.
The medical community offers great opportunity to help address the issue of weight bias, because with positive attitudes, people will get better care, but not only that, but it'll be modeling for the world about how overweight people should be treated and what weight is. It shows that weight is an issue that needs to be dealt with in medical settings in a straightforward, positive, constructive way. And as people see this, then they see that weight isn't an issue where there should be tremendous prejudice and stigma directed at individuals. Rather, it should be a straightforward medical condition just like anything else.
In spite of millions of dollars spent every year on weight loss efforts, long-term results in America point to the fact that there are obviously other factors at play beyond intention and commitment. Yet, the increasing prevalence of obesity in our society has oddly not reduced weight bias. With more and more people overweight, one might think tolerance would increase, but it hasn't.
At the Rudd Center, we work hard to eliminate the problem of weight bias. We believe that there's a strong social injustice occurring here, that hundreds of millions of people around the world are deeply affected by this, and it just doesn't need to occur. Race bias doesn't need to occur, gender bias doesn't need to occur, and weight bias doesn't need to occur.
Thank you for taking the time to watch this educational video on weight stigma. For more information, please visit the Rudd Center for Food Policy and Obesity at yaleruddcenter.org.